This video shows the cardiac clinical patient pathway. The patient in this video is 87-year-old Elsie Smith, presenting at the emergency department with chest pain and breathlessness. She's been diagnosed with aortic valve stenosis disease and has an upcoming admission date for valve surgery, but in the meantime, her condition has deteriorated. This video will follow Elsie's patient pathway, from the emergency department through to discharge, managed with the ORBIS U EPR. The triage nurse can see all the patients who are in the emergency department. Each has a patient card with their information, including status, alerts, allergies, and presenting complaint, along with current planning, lab orders, imaging and medication to provide an at-a-glance view of all ED patient status. The triage nurse initiates the triage form for Elsie, entering her complaint of chest pain, adding medical history information and Elsie's medications. The triage nurse can follow the roadmap on the form to determine next steps and can record their own notes using speech recognition. The triage nurse allocates a Manchester triage category of 3 for Elsie. Now, our view is from the perspective of the emergency care doctor. Using a tablet, the doctor begins the physician assessment. The doctor can see all the information entered by the triage nurse and they decide to urgently admit Elsie for valve surgery. In the inpatient ward, the overview of patients is based on the configuration of the ward. Each patient's card indicates if they are in the ward or are currently elsewhere for imaging and surgery. The doctor initiates an admission assessment for Elsie, entering planning steps and information such as medications. Clinical decision support is built in, and it's easy to add next of kin and additional medical history. The doctor can enter the details from their physical exam of the patient and also update and manage Elsie's medications. This view is that of the inpatient nurse. The nurse can see all the testing and medications that have been ordered by the doctor for Elsie, and it's all integrated into the nurse's care list for the ward. The nurse can update Elsie's patient chart, which holds all clinical information, timeline for medication and tasks, and all nursing planning. The nurse can also see that Elsie's early warning score is rising, meaning that it's time to proceed with Elsie's surgery. Now we've jumped ahead in time. Elsie has had surgery and she's ready to be discharged. Here, our view is that of the inpatient doctor, who creates a discharge summary with all the information for Elsie's GP. It auto-populates with information, and the doctor can add their own notes, as well as directions for post-operative home care and dates for follow-up appointments.